Yo, guess what? This is another episode of Hi There, man. Listen, my man right here usually mic'd up with the doc, but today, this is Dr. Arlington, man. Welcome to Hi There, man. Tell these folks what's going on, doc.
What is up, man? Thank you so much for having me. I'm stoked for this. I'm
Yeah,
excited.
yeah. Now let these folks know what it is that you do.
I'm a doctor of physical therapy.
Mhm.
I'm the owner of Magelitz Conservative Medicine. So
Let them know the location. Let them know you got two of them.
So we got two locations. We're located in Springfield,
Mm-hmm.
and then we're also located in Verdon.
And listen, if you don't know, people that hard to listen is right here. Okay, we gonna put exactly where it's located right there. Okay,
That-
this is the best PT physical therapist. Okay, the best PT I have ever ran across. Right, I had met Doc through a mutual friend. Right, came there and I'm just like, I ain't never did no physical therapy. Like, you know what I'm saying? Like, this ain't gonna do what I needed to do in a short amount of time. Like, one session is not gonna fix me.
right?
At least that was my mindset going into
Yeah.
it. Listen, I got this clip. I do not act. I'm telling y'all. Couldn't even stretch down to reach my toes. Put me through, what was it, like 30 minutes?
Maybe 40.
40 minutes to where the point, by the end of it, I could put palm on the ground just about. What made you want to get into this, man?
It couple things. Main thing is shout out to mom and pops.
Shout out.
They kind of steered me in that direction there.
Mm-hmm.
When I really got into physical therapy school and realized like all of the cool stuff that we can do and what we can fix
Mhm.
without pills, surgery, and all the other
Right.
crap there, that's when I realized like, man, this is really stinking cool.
Yeah.
Like, and that's when I lit the fire of like, I love this and I love what I do.
Right.
And I want to spread it.
Right. So what made you want to branch off to your own clinic? Like, why didn't
Yeah.
you want to work with somebody else?
Yep. So I did. I worked a couple different places, managed for a more corporate place,
Yep.
and did the whole 9 yards there.
Yep.
And I realized that there's really two things that prevent you from getting the care that you need. And that is corporate telling clinicians what they should and shouldn't do, and that is insurance companies saying what they will pay for, what they won't pay for, and what you're allowed to do.
That stops a lot of people from getting the proper
God.
treatment for their body. That's the main thing. Like that, them two things right
Yeah.
there is which made me like, oh, I have to lock in.
Yes.
Like for me to come here and be like, hey doc, insurance ain't got this, you know what I'm saying? I have a payment plan I can set up $200. I just need my back fixed.
Yep.
That's more so like where it comes to like that sets you different from everybody else.
Yep.
Now, how long have you been having the clinic up and running and everything?
Yeah, so I started it part-time back in January of 24,
Mhm.
just on the side, because I was like, I'm the only cash-based or concierge therapist
Mhm.
between, gosh, like Champaign and St. Louis. There's no one else. There's no one else around here that does what I do. So I just started it part-time, like just to see.
Right.
I don't know, let's see if this catches on.
Right.
And it started growing, and then I got to August of 24,
Mhm.
and I went full-time. Like, so we got to where we were busy enough that I could do that.
Yeah.
And then we hit April of 25, and I bring on my first fee,
Right.
which is I bring on my physical therapist assistant.
Mhm.
She's an
Mhm.
absolute baller. She's so good. And
Mhm.
it's just, we just keep growing. We're looking at what we can add next, what specialties we can add next,
Yep.
and how we can serve people.
So
better.
when did you realize like, oh man, like this is getting big, like this is getting like huge, like I have to quit my job and have to, well, not even quit, like I have to go full time, like I need
Yeah.
another employee. Like when did that turning point and how did that make you feel?
Yeah. It was amazing, and it was also like the most scary time of my
Mhm.
entire life, because I was working just insane hours. I mean, I'm talking like 80 or 90 hours a week. I'm just seeing patient, and then all of like the running the clinic and also doing the content and stuff. I was just like working insane hours, and like I loved it. It's amazing,
Right?
like I love it. I believe in it, and I want to grow it. There's so many people that deal with so much pain and crap that they shouldn't.
Right.
And it's like I'm gonna do everything that I physically can to make a change in this.
Yeah.
So I got to the point, and my wife pointed out, she's like, you can't work like this
Right.
forever. Like, yeah,
Right.
you're 28. You can put in these insane weeks now, but like, you can't forever. I'm
Yeah.
like, yeah, you're right.
Yeah, like that's not something that you want to do. You don't
No.
want to work 80 and 90 hours.
No.
What, you have to have a time for a social life. You don't have
No.
a time for no life, especially if it's patient. after patient
Yep.
after patient. So let me ask you this: so what's something that you could tell people like a everyday thing, like an everyday workout they can do in the house without like actually going to see a physical therapist or a chiropractor or something like that? Like, give me some that I can do at home every day.
So let's start base level.
Okay.
When I work with patients, I go through what's called the neurodevelopmental progression.
Okay.
Big word to say. It's just how you learn how to walk.
Okay.
Like a kid, right? So we figure out how to roll over. Then we go to hands and knees and crawl.
Right.
Then we go to kneeling.
Right.
Standing, right.
Right.
So that's how we start when we're retraining and fixing stuff. So let's start like base level with like that. We're
Okay.
laying down the simplest thing, and I say simple, it's not. But if you are laying on your back, some legs extended.
So does this have a name? Because I'm
Yes.
gonna put it right here.
Yep.
I'm gonna put it right here.
We can link it there. It's called segmental rolling or supine rolling progression there. So what you're doing is you're just trying to roll from your back onto your stomach without using your legs. So you're using your arms, you're using your head and your core, and most people can't do it.
I can't do it. I know for a fact I can't do it.
Like most people can't do it. It's hilarious. And that's kicking on the deepest and most important parts of your core and even a little of your pelvic floor as well.
Yeah.
Like people have no idea those muscles even exist.
No, I do not.
And it's horrible for them. It's great for business though.
Yeah, it is. That's how you make your living. So
Exactly.
I'm knowing. I can't see me like I'm trying to imagine me standing like being on my stomach and rolling over. I'm gonna try this when we get done. Just believe that I'm gonna try this, and I might put it in the video to where y'all be like, Dre, you can't do this. Like you can't even do it. It's not something that's done. Everything. So what would you say the most problem that you've encountered with your patients, as in like the area that hurts the most?
Okay. So the most common for sure is low back pain. Everybody's back hurts, right? Yep, there it is. Everybody's back hurts. A lot of people have neck pain and headaches. That's one that I work with a ton. And the other one, I see a ton of shoulder injuries, specifically with bench press. And that's mainly, I think, partially because of where the clinic's set up. Both of our clinics are inside of gyms.
Right.
So I see a lot of powerlifters, CrossFitters, bodybuilders, stuff like that. And it's just like, when I first started treating, it's like, does everyone hurt their shoulder with bench press? Like, you shouldn't.
Just about.
It's a large portion.
Yeah.
The patients I see are shoulder pain with bench press.
Yeah. So how did the headache come in part? Like, where did that come from?
So there's a lot of different causes for headaches. Of course, we can have some like nerve or neurological issues, but a lot of them are actually what's called referral pain. So think of like a stress or a tension headache where your neck is really, really tight, and then you get a headache from it.
Yeah.
All that is pain moving from muscles in your neck, and you can track it like based on where the headache is at.
Yeah. In
your head, face, behind the eye, or whatever.
Yeah.
I can track them based on where you're feeling that headache as to what muscle it probably is.
Wow.
Then we calm down that muscle. So we dry needle, cup, scrape, whatever.
Yeah.
Do whatever manual thing we need to calm it down.
Yeah.
And then we got to look at the root cause of why was that muscle angry in the first place? Why is your sternocleidomastoid here? Like, why were you overusing it? Like, you shouldn't.
Right.
There's no reason to.
Right.
Let's figure out what that is.
That's incredible. I just thought headache come from me stressing about work.
Yeah.
That's what I'm thinking that it's coming from. But it's like,
there's so many things.
Literally so many. And it's crazy that like something can fix it within like that.
Right.
And then for y'all who haven't been there, the setup at the gym is so marvelous. It's almost like you going into like heaven, like peace, like
bougie, isn't it?
Like it's just so. It's like your body is automatically relaxed. Like you walk in feeling a sense of calmness, and I love that. Is there a reason why? I mean, obviously, there's a reason why you wanted like that to go, but like that was that more so like the intention on having a calm setting for your patients.
So think of when you go to the doctor and think of when you go to the hospital, right?
Right.
You feel like just another cow in the cattle chute, right?
Every
it's
time.
Industrial. It looks like you're in a factory because it is.
Yep.
Right? The healthcare system's a factory. We can delve on that later.
Yep.
But do you feel cared for? Do you feel like an actual human being? No.
Not at all.
No, dog, you're just another number on a spreadsheet.
Literally.
Right?
Literally.
No, when you walk in, I want you to immediately calm down a little bit.
Right.
And realize, like, okay, this guy is he's just cool.
Yep.
He's just here to fix my pain.
Yep.
Yeah, he's a doctor, whatever. That's a cool title. People just call me by my name. Like, I'm just Marlon.
Yeah.
Usually.
Yeah.
Right? So that immediately takes you from being tense and having, it's called white coat syndrome, is the actual term for it, of being, like, super tense when you go to the doctors. You know, like, they're not going to listen to you. You get 6 minutes of them seeing you, 8 minutes if they're Medicare, so you can hit the billing unit. They're in and out, they don't care, blah, 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 blah. I want to change that from the minute that you step
walked
in. I actually want to change it from the minute you contact us, because our first question we ask you, or I guess it would be our second question. First question's your name, right? What's the second question that every doctor's office or hospital asks you after that?
Do you have insurance or not?
Bingo.
You got insurance or not?
So what are they actually asking with that? They're asking, what is your name and how are you going to pay me?
Literally.
What other scope of business is that acceptable? Right? Like,
I can't
that's
really
what's
tell
your
you
name?
something.
Are you going to pay me? How are you going to pay me?
Yeah.
Like, no. When you call us, it's what's your name, what's going on, and how can we help?
Right. It's not even about the money.
No, I don't care. If I could do it for free, I would.
Right.
I do like making money.
Right.
I like putting food on the table for my family and taking vacations and stuff.
Understandable.
But, like, if I could do it for free and money is not a thing, I would do it like probably 70 hours a week.
This is what separates. Now I understand, you know what I'm saying? Like, you a concierge to take cash and all that.
Sure. Yep.
Fuck that, doc. This right here, that what separates you from the rest of anything that's going on, doc. When I tell y'all, when I first walked in, I felt that. Like, from the moment we talked, the connection we talked, I was like, how you explain how you want your patients to feel?
Yes.
I felt that.
You immediately you go from being kind of stressed out.
Right.
Like, okay, this is cool. Like, this guy's it's just a problem and I'm here to fix it.
That's it.
I'm just like a carpenter or a plumber or a car mechanic.
Right.
I just happen to fix your muscles, bones, joints. That's it. I view it as a trade.
That's exactly what it is, and that's how I saw it. And I'm like, this here, like, I've gotten so much better, and I've been in tune with my body so much since then.
Yeah.
I've been trying to do proper stretching. I've been trying to look up stuff to be like, okay, how can I stay loose? How can I stay flexible? That's why I asked you, what's some everyday things that you could do at home, which is the we're gonna call it the turtle roll, but what's the regular name for it?
Supine flexion rolling, if you want the really technical term there.
But AKA what?
AKA turtle rolling.
The turtle roll. That's exactly what we're going to call it, because I know half of y'all can't say that. So let me ask you this. In your opinion, where does mental health intersect with physical therapy, and how do you acknowledge that?
That's a fantastic one. And there's actually a ton of research on this. So I'm going to take this from like an athletic performance standpoint, is I think how I can answer that the best.
Okay.
I love working with, I've got some pro athletes, hoopers that that come see me.
Yep.
Plenty of college athletes, plenty of high level high school ones. So when let's say you tear your ACL, let's start with the big one.
Okay.
Right? There is such a mental aspect of getting you back to sport.
Right.
It's not just are my quads and my hammies and this blah blah blah, are they strong enough? That's cool.
Right.
Do I actually trust this new piece?
Right.
Right. So there's there's a whole grieving process usually for athletes, just like if you lose a parent or something, right?
Mm-hmm.
Like, you go through all those stages of grief of, I just lost this season,
mm-hmm.
right? Like, I've seen going into their senior year, a kid blows out his ACL.
Worst feeling in the world.
Worst feeling in the world. You just lost senior year football.
Yep.
Which is huge in Central Illinois.
Yes.
Right?
Yes.
You probably lost senior year basketball, depending on when you tore it in the summer.
Yes.
And maybe if you're a spring sport, you might get that. Like, and you miss the big ones, the big football and basketball, right? So you have to actually work through that with patients as well. I'm not a specialist in it by any means.
Yep.
I have some specialists that I know that I will refer to often, because I'm like, this is important things that we need to work through.
Right.
That are going to inhibit us actually trusting this leg.
Facts.
And getting back onto the field.
Right, on the right way. Like, tearing the ACL or something like that, that's scary.
It's very scary.
You can't make the same moves you want to make.
Yep.
You can't do the same. You can't train the same way you want to. You have a fear and a phobia of reliving that moment.
Exactly.
But to come back and see like a PT who actually cares, take the time to nourish your body, tell you the proper things, actually care for what they do, and then to come back like a comeback season, like a revenge tour.
Yep.
That's the greatest thing in the world.
Yes.
What's the proper time you need to stretch before a performance?
So let's walk through everything you need
right
for the performance, right?
Right.
And so we usually think of, let me do like my splits and my hurdler stretch and everything there. There are mountains of research to suggest that static stretching before sports does absolutely nothing for you.
Did not know that.
If anything, it might even make it worse.
Did not know that.
So think about if you take a rubber band and you go throw it in the freezer. right?
Right.
And let it sit there for, say you're a high school athlete, sit there for the 8 hours that you're in school,
Mm-hmm.
and then immediately go take it out of the freezer, which has been you sitting
Right.
all day for 8 hours,
Right.
and then try to stretch it as far as you can.
Collapse.
Bingo.
Right.
Exactly right. So at the worst, we might have some tearing there. It's not super common to do that, but more commonly, like it's the muscle is going to want to tighten up as a protection mechanism from that.
Did not know that.
Right. So we're honestly like making it worse there. So what we
Wow.
should do, it's called a dynamic warm up. So we start with like light jogging, get the heart rate up.
Okay.
High knees, butt kickers, karaoke, all the stuff that
Okay.
we think of.
Okay.
Right? So we get stuff moving, move everything through a full range of motion, like nice and slow, and take your time there.
Yeah.
And then we have to delve into what your specific body struggles with, what like Dre's body struggles with.
Right.
Right.
Right. Because everybody's different.
Everybody's different. Go watch the Cardinals when they do batting practice. In the middle of batting practice, you've got players doing that supine flexion rolling.
Turtle
roll. I've seen Albert Pujols doing that in batting practice. I've literally seen it. I was like, I know what he's doing.
That's crazy. $1 million athletes.
Yes, doing that exercise there.
Damn.
So for whatever reason, when I saw that at the batting practice, he had some kind of core or stability issue that he was working through as part of his warm-up there. So he's basically reminding himself, here's my core muscle, here's how I kick it on, now let's go play sports with this thing kicked on here.
That's wild.
It's cool, right?
That's dope. Like,
right?
What? Never. And I'm sitting here warming up. I'm sitting here stretching. I'm sitting here doing my whole nine. But I was just telling this guy that we hoop with. His name is Nick. And he was like, Dre, you don't never stretch before you work out. I'm like, man, I come to hoop. Like, I don't need to stretch. I don't need to do none of this. Like, I'm coming to hoop. Y'all taking all day, this, that. We ain't getting paid for it. Let's hoop. Other guys, I see them with a tennis ball or whatever, rolling their foot on and everything like that. But it's like, y'all hurting y'allself.
Mm-hmm.
Okay? Y'all have your muscles tightened before the actual hoop, and that's why y'all sorry.
That's right.
Okay? So I just wanted to point that out to him, Doc. I just want to point it out.
That's why you're getting dunked on.
Literally. I'm like, okay, I'm going to give you a body part. I need you to tell me the first workout that comes to your mind.
First workout, body part. Let's do it.
Okay. My shoulder hurt.
Shoulder hurts. Where on the shoulder? Front, side, or back?
Back.
Back of the shoulder. We're probably talking your infraspinatus or your teres minor, which are muscles on your shoulder blade.
Okay.
If not those, we're talking about muscles around your shoulder blade. Let's go with those first two.
Okay.
Those are part of your rotator cuff. You've probably heard of that.
Yes.
Those two guys back there do external rotation, which is rotating your arm back.
Mm-hmm.
Like we're rearing back to throw a pitch, right?
Wow.
So if those muscles hurt, let's assume we haven't torn them,
right?
No major injury or anything.
Right.
Let's just work them first. Just literally with a band, hook a band into a door frame, row it to here, rotate it back.
Just that simple.
Let's just start there. Let's go bare bones and just see if it hurts. And then if it does hurt with that, and that doesn't calm it down, then we got to delve in more.
Oh my! So all I need is a rubber band.
Yep. And
a door hinge. It's almost like throwing a fish, like a fishing hook.
Yeah, I think it's just like that.
My knee hurt.
Knee hurts. We talking muscly, or we're talking more deep in the joint?
More deep in the joint. Like it's like when I pull out like to kickball.
Yeah.
It hurt.
So typically with that comes from people having issues with tibial rotation. And what I mean with that is, so your tibia is your shin bone. You actually rotate at your knees. We all know that our knee flexes and extends.
Right.
Extending is straightening, flexing is bending. We know that.
Right.
Your knee also has to rotate. That's a little bit. We're talking like 10 or 15 degrees one way, 10 or 15 degrees the other way. That is there. That's how we lock out and unlock our knee. Like when we walk, jump, we squat. And typically people, they don't even know that motion exists, right? You didn't know that.
I did not know that.
Nobody knows that. And when I work with professional athletes that know their bodies, they don't even know that exists. It's super important.
Insane.
We're talking just like a 30-degree range of motion. It's like that much, and it's like integral to how we move our body, especially with like cutting and pivoting. So like football, basketball.
Yep.
We don't know how to do that. We don't have good control of that. We start pinching on the meniscus. We start pinching on the joint capsule. We might make some of the muscles around the knee angry there. So think of like a bridge exercise. Where you lay on your back, you push your bottom into it. Do that. Knees are facing forward, but you're going to pigeon toe. So point your feet in. Give me like 10 or 15 there. You're going to feel like this weird torquey kind of thing. As long as it doesn't hurt. Yeah. It should feel weird and torquey. It's probably
Which
a good
it
thing.
will.
So give me 10 or 15 pointed in, 10 or 15 pointed out. Now we know how to rotate our tibia.
You're welcome.
Boom.
You're welcome. You can watch this video
Right.
back if you need to, because you really giving them tips, really putting them on. My boy Jumpman, his disc, lower back,
Disky stuff, okay?
yeah, help him.
We're gonna dispel some myths here. First.
Okay.
Let's start there. So I love talking about the disc.
Okay.
So the disc in your back, they don't have any nociceptors. What I mean by that is the nerves that carry the sensation of pain are nociceptors. We don't have those on our discs. Discs in and of themselves cannot hurt.
Wait.
Yes.
Wait.
Yeah, you've been sold that, haven't you?
Wait. So,
Yep.
so you mean to tell me he been lying about his pain?
I'm not gonna call him a liar.
If his disc don't carry nothing, Doc. So that's what I'm saying. The
Yep.
body is so weird. So
Yes.
what is he feeling?
So there's a couple different things that can cause pain in the back. So let's go with the disc thing first.
Okay.
If our disc is like bulging or herniating, which is it like going out of place kind of thing there.
Okay.
It can shimmy out of place and it can impinge on a nerve. So think of like your whole nervous system going down your legs, right? Think of it like a line of like a power grid.
Yeah.
So all like the power lines that go through town kind of thing.
Okay.
Think
Okay.
of the spinal cord as like one of the main transformer hubs.
Yep.
Nerves come out of that.
See.
So if we go out onto the street here, cut down the power line, from that point where we cut it, on down the street, we'll no longer have power,
Right.
right? So the same idea of if we pinch on a nerve, from that point on down is going to be funny and weird.
No
it's
pain, no
usually-
nothing.
It's not, it should probably be painful. It's usually like a burning sensation, like burning, numbness, tingling, that kind of
Yeah, I heard him say that a couple times.
That goes down the leg, right? So that is the most common disc issue. It's not a disc issue. It's the disc is being like jacked up and it's impinging on a nerve. Okay? So typically with that, we do what's called repeated movements, which in the case of a disc herniating, usually it's herniating back. So we put pressure backwards to push the goop that's inside of the disc back forwards to where it goes. So think of like an upward dog or like a cobra motion from yoga.
Yeah.
Doing like 20 or 30 of those. And if that makes a change, if it starts to improve it, it's probably actually a disc issue. If it doesn't make a change, there's one or two options. It's either a horrible disc issue that we got to go in with like a vacuum and like take the crud out.
Oh.
Not that common.
Oh.
It's very much not that common, let me tell you. I dispel this myth with patients like 3 times a week at least.
Okay.
So it's either that or it's actually not a disc issue and we just saw a disc that's kind of bulging on an MRI, which is a snapshot in time.
Right.
That MRI tells me that, yes, your disc was bulging in that position with that barometric pressure and temperature,
Mhm.
with that hydration level of that day at that specific time. We have no idea if it's still bulging or not.
Right.
We don't know unless we just do MRI after MRI after MRI.
So have you ever had a patient to where it's like you was like discouraged that you couldn't like cure him or anything like that?
I've had a couple really interesting ones. There's one that sticks out in my mind that, so I had just got out of PT school. Like I'm
Mhm.
super, super fresh.
Mhm.
And this patient was a doctor of a different kind. I probably can't say, but did not specialize in musculoskeletal
Right,
system. Specialized in something else. Brilliant individual. Comes in with literally that case. Says, hey, I've got an MRI that shows I have a disc that's herniating.
Wow.
Here's the pain I'm feeling. And the pain this individual was feeling was not related whatsoever to like a nerve. So it wasn't actually a disc issue. But I was like so scared. I was like, this is a doctor. Like they obviously are smarter
know
than
what's
me.
going on.
Yeah, it's like,
Yeah.
they have to know more than me. So I
Yeah.
start treating with that kind of stuff, and I didn't make it any better. I saw her like 2 or 3 times, and that was it. And I still like to this day was like, God, I wish I could go back and just like
do how you want to do.
it like what I do now.
Right.
Like no, I understand that we have this MRI that shows this, but like your pain is obviously a muscle, so let's treat the muscle instead. That one like haunts me. I still think of that at times. It bothers me that I missed that one.
But come on now, Doc. You fresh out of PT school. You just trying to go by the book, and then
Exactly.
It's common. It's
Exactly.
common to
Yep.
happen every day. I would have never thought that.
Yeah,
I would have never thought you had like a patient that you can't cure, because obviously people come to you for a type of service, and then like if you can't do it, then what are we doing?
Absolutely.
Right. So it's like, how did you deal with it? Like how did you handle that?
I mean, I just told myself like, hey, like you can't fix everybody.
Correct.
Like I think I bat on a pretty good batting average with helping patients.
Yeah.
You can't help them all.
So what's something that you learned from a patient that like changed your practice?
Man, there's so many. Probably the first one is it's so easy to stereotype patients based on anything, gender, race, age, whatever, right?
Yep.
The one that sticks out in my mind is this. I was still working at a different clinic. We had like a lot of doctors that refer patients to us.
Mm-hmm.
So I get a referral. It's like an 81, 82-ish year old lady with low back pain. And the stereotype there is, oh great, it's grandma that sits and watches Wheel of Fortune all day.
Yeah.
Right?
Yeah.
Doesn't do anything. This is going to be boring. I like my athletes. Like, give me cool stuff to fix, right?
Really hurt.
Exactly.
Really hurt.
Give me like something that is really cooked that I actually have to fix.
Right.
So immediately it's like, oh, this is going to suck. I'm going to hate this. So I like meander my way into the room like to see what's going on and evaluate her. And I walk in, she's wearing like all Lululemon and Patagonia stuff.
Okay.
And it's like a beacon of health. And I was like, oh shit, I am so wrong here. So I was like, okay, so what's going on? How can I help?
Right.
And she said, oh, I'm getting ready for a hiking and like excursion trip in Antarctica. And when I have my Antarctic gear on, yes.
82-year-old woman.
82, I'm not lying. I'm being dead ass with you.
Wow.
82. And she's like, yeah, I'm getting ready for a hiking expedition in Antarctica. And when I have all my Arctic gear on, it bothers my back. And it's like, I want to be like you. When I grow
literally
up,
like
so
82,
cool.
and that's where your problem come in as for carrying all this weight up. Of course, grandma.
Yeah, damn grandma. Like,
What are you doing?
Yeah. No, that was one of the coolest ones. And that immediately like set the tone of like, okay, it doesn't matter the age, gender, race, whatever, sexual identity, whatever it is. You've got to go in with an open mind of every patient is different. Yeah. And that I'm so glad I learned that like on someone else's dime. Yeah. Right? Like I learned that when I was at a different clinic before I had like my name on the door. Right. Because now it's I don't care what you look like or anything. Right. You're my patient and I'm going to do everything in my power to make it better.
Okay. Okay. So many people think of PT as something you need after surgery or an accident. What's a lesser known way for physical therapists can improve everyday life?
Yeah. So I honestly, I hardly see any patients after surgery. Now, truly. I've got, two on my caseload right now, and that's because I'm really good friends with a surgeon here that when something is really messy and weird, he sends them to me. Yep. So, when I get a message from him referring a patient, I was like, oh, boy, this is going to be interesting. Yeah. Outside of that, so you have what's called direct access to physical therapy in all 50 states. Now, Missouri was, the last one to finally get on board. They got on board last year. Mm-hmm. So, a physical therapist is not just giving you exercises to do after an ACL.
That's what most people think. That's what you think. That's right? What I thought. Therapy was.
Exactly. So a physical therapist, it's a doctorate degree. You're a doctor of physical therapy. Okay. It's an independent clinician that you have direct access to. So let's go back to the analogy we had earlier with mechanics and stuff. Mm-hmm. When you have an issue with your car, you take it to a mechanic. Facts. When you have an issue with your sink, you call a plumber. Facts. When something hurts, you can call a physical therapist. That's
incredible.
That's what we do.
Incredible. And my thing is, once again, it's hard to call a physical therapist when your insurance ain't paying for it, or when something like that don't come along, and then you just thinking what do I do? Yeah. Now, do you do house calls?
I do, actually. It's not super, super common. Right. But I have had some patients where they will call the clinic and be like, I cannot get out of bed. My back is seizing when I get out of bed. I can't. So I've gone and seen them at their home. Yeah. Calm down the muscle enough that they can actually get up and get moving, and then I'll see them in the clinic the next day too.
So when you say calm down the muscle, what does that consist of? What is that? I know the suction cups, was that one of them? Yeah.
So that brings up basically what we do. So what I do with patients, it's called the 3 R's. Okay. So you've got to reset, reinforce, and retrain. Okay. So a reset is the stuff we do to calm down the muscle. So that is cupping, which you've probably seen with Olympic swimmers, how they have the dark marks on them, right? That's what we did on your back.
Yep. Feels great.
Right? It's fantastic.
Yes, it is.
We got cupping, we got scraping, which is, think of it like a massage, but I've got a tool that I'm digging on instead. Right. As opposed to my hands. We also can do manual therapy of working with our hands. Yep. We also have what's called dry needling, which I don't think you and I have talked too much about.
No, please explain that, because that seemed cool, but it seemed like it hurt. People ain't fans of needles. Yep. Explain that to my people.
So dry needling, think of it very similar to acupuncture, which most people know what that is.
Right.
So we're talking a very thin needle, Bing! And I'm not going to call them long, but I'm not going to call them short needles either. It depends on what muscle you're
Right.
moving it into.
Right.
But think of it, if you have a muscle that's really angry, that's like knotted up, if you take a thin needle and drive that directly into the muscle, it's kind of like hitting your knee with a reflex hammer. So that makes the muscle kind of twitch a little bit,
Yeah.
and then relax a little bit. And then, so you can do just the needle where you poke it into the muscle and kind of work it around and make that muscle twitch and
Right.
relax them. It's really weird because like you actually feel your muscle twitch,
That's crazy.
but you're not in control of it. So that's one option. Or two, the more cool one that's like more science experimental,
Yeah.
is you can pair it with a TENS unit or an E-stim unit. So some people have heard of those where like you put patches on your skin and it puts like a little electricity through there.
What?
So what we do instead of using patches though is I've got these little, they're kind of like jumper cables
Yeah.
that you would start your car with.
Yeah,
They're
okay.
like little tiny ones that you would use for like a Hot Wheel. So you clip them onto the needles, you put two of them into like say your low back muscle. And it puts like this little low grade electric current over and over through it, and it just makes that muscle twitch and relax. Twitch and relax, and just over and over and over.
So it's physically causing the muscle,
Yeah.
like direct
Yes.
to the muscle.
Like you can actually feel it and you can see it, which is the really cool thing.
That's cool, Doc. You talking about
It is
something that's
sick.
cool. This is a physical therapist
It's
talking.
cool.
I want to see my muscle twitch
That's
back
right.
and forth.
Yep.
That's
No,
crazy.
it's cool. That's the reinforcement that we do there.
Yeah.
Or excuse me, that's the reset that we do there. Then we follow that with reinforcement, which is whatever range of motion that we open up. That
Okay.
We then have to use it, otherwise it just goes away.
Yeah.
Like I don't pop your back or just needle you and kick you out of the door.
Yeah.
Because it's gonna feel good for like a day or two,
Yeah.
and it's all gonna fall right back to crap.
How many people do you get would be like, oh, I'll pop my back like constantly, like,
Oh my god, it's all the time. And I'm like, it's in some cases it helps. If you have a mobility issue in your lumbar spine, yeah, that kind of like shimmies stuff and gets it moving again.
yeah.
But then if you don't work on your underlying issue, it all goes right back to where it was.
And does it makes it worse?
It's not that it makes it worse, but it just never gets better. And if you're talking like you're popping your back all day, every day, there's a
Yeah.
lot of evidence that causes a lot of laxity in your joints, and that can cause like a lot of pain and discomfort there.
Every time you mention like a body part, it's just like my body get to twitching. Like I'm like, man, like a back problem.
Yep.
Okay, so that's the second R. So explain the third
Yeah,
R.
so that's reinforcement. So we just move it through the range of motion that
Mhm.
we open up to make it stick there.
Mhm.
Then we retrain. That's where we get like more like Sherlock Holmes detective-y.
Yep.
Where like I have to figure out why your back hurt in the first place. Like why did those back muscles get angry to begin with? They don't just do it for like fun.
Right.
There is a biomechanical reason. So we start looking at like how do all of the muscles in your body around that helps to support it, how do they do their job correctly? Or like how do they do their job? Do they do it correctly? Can you even kick them on? And eventually we come up with like this laundry list of like here are the 3 or 4 things that your body struggles with. Here is the one that I think is most likely leading to you overusing your back muscles. Let's retrain how that works first. If it gets better, sick. We
Right.
got it. If not, then we just keep going down the list.
Hey, listen, man. You got to reevaluate your life, okay?
That's right.
To all my members that's listening, take these tips,
Yep.
okay? These are really hitting gems that you didn't even know,
Yep.
that I didn't even know.
Exactly.
I didn't. Okay. Advice for an athlete. Just advice for an athlete. Just give advice to an athlete,
Just,
doc.
like, just flat advice to
Just
an athlete.
if you could tell an athlete one thing, what's the only thing, the most important thing you would just tell that athlete as far as taking care of his body?
I would say probably the most important is that dynamic warm up that we talked about there.
Yeah.
Like you have to prime your body for movement. Like sports are so high level now. Like I see like 9-year-olds.
Milling.
Exactly. Like they're windmilling. Like they could totally cook me on the court. I'm 28 years old.
Me too.
They could
Don't feel
obliterate
bad.
me. Like
Me too.
the level of performance that we get out of the human body now is insane.
Right.
That if you an analogy for that is if you take like a V12 engine out of a Ferrari, right?
Okay.
That's all like your athleticism, your power and speed and stuff.
Right.
If
right.
you take that and you put it in a Toyota Camry, how is that going to go?
It's not.
No, it's going to blow up.
It
You're gonna
definitely
obliterate it,
is.
right? So we have to have all of these other pieces that go with that V12 engine, right?
Right.
We got to have the Brembo brakes and the Pirelli tires and the Ferrari suspension system and their
The
transmission.
whole nine.
Right? We have to have a good warm up. We have to have good motor control of like be able to move the body correctly there.
Right.
So it's not just like speed and power is what I would say.
Okay. So
Everything has to work correctly.
So what's some advice as far as like recovery, right? So you're coming off an
Yeah.
injury and You just sitting at home. What's something that you could be doing while in recovery?
Yeah. The one thing, we're dispelling all sorts of myths.
Yeah, I'm telling you, like
The one thing, and this is going to piss a lot of people off, okay? What do you typically do after you sprain your ankle? What's like the first thing that you do when you...
ice it.
Yeah. Don't do that. That's right.
My life been a lie this whole time, everybody. My life been a lie this whole time. Okay, so listen. Okay, before we get into that,
Yep.
so when you sprain your ankle, they be like, tie your shoe tighter. Is that the thing you're supposed to do?
It doesn't change much. Like, you can. It's not going to change much, though.
Oh my God,
Yep.
What was you at when I was in high school?
Right? Yep. So that's the other part. So the acronym, right? You guys probably know it. RICE. Rest, ice, compress, elevate. That's a load of bullshit.
Oh my God.
It has been completely redacted. They... He's got some wine out to deal with this.
I'm telling you, man. Break it down, Doc.
Yep.
So what are you supposed to do?
Yep. So the new acronym that they've come out with, it's called Peace and Love. And I'll be honest, like I can't recite all of it. I don't have it memorized.
Don't worry about it
But-
because it'll be right here.
I said, we'll throw it
we'll
up
put it
now.
right here.
Yep. So the general idea, and this is after any acute injury, like not something that we have to repair surgically.
Right.
So like this isn't ACL stuff. That's
Right.
totally different.
Yeah.
Come see me.
Yeah, for that, please.
Yes, and then let's get you set up with a good orthopedic surgeon. Sprain ankle, sprain wrist, mess something up in your shoulder, whatever. The main thing is we don't ice it. Number one. The reason we don't do that is that causes vasoconstriction. So that means it decreases the amount of blood flow to that area. That's how we get rid of the swelling, right? Because there's not as much blood coming in there.
Right.
But that's how we fix things. Like your blood brings in the chemicals and the proteins to rebuild structures. And then it takes it out through the veins there. If you slow down that process, that is like taking a massive construction site and cutting the amount of dump trucks and track hoes and stuff, cutting it in half.
It's gonna take forever.
It's going to take forever. There's so much research that shows this too. Like icing slows down your healing process. And all it does, it does make it not feel as bad, right? That's because it numbs it because it's cold. Like it can't hurt if you can't feel it. It doesn't actually fix anything.
It's just a temporary satisfaction of not feeling the pain.
Exactly. That's actually setting you back.
So what should I do when I sprain my ankle?
So let's talk sprained ankle. Let's assume we haven't broken anything,
Gotcha.
right? So what we should do is we should keep it moving through as much range of motion as we can.
So keep walking.
Keep walking to the best of your ability. Don't throw a brace on it for the love of God. That's another one. Like don't throw the boot and don't throw the brace on it. Because after an injury, when we get back to walking and stuff, your body is always learning,
Right.
right? Even now as we are like sitting here, our bodies are learning like how to stabilize on the couch.
Yeah.
If we have a big change in your body of like massive stretching to the ligaments in your ankle,
Yes.
your body's immediately going to start learning from that. It's like, oh crap, what happened? What do I do?
Right.
Right? So if you throw that brace on there, your body starts learning that how to move again with the brace as part of your body, which it shouldn't be. It becomes a crutch, right? So look at who is the poster child for wearing ankle braces.
Steph Curry.
Yeah. And what is he guaranteed to do at least one time in the playoffs?
Roll his ankle.
Every time. Exactly.
Steph, call us.
Please. Yeah, Steph, call me. Let's fix it.
Hey, I got the doc that can fix it for you quick,
Got it.
Steph, because that's not what you supposed to do.
Nope.
So advice to Steph on how to strengthen your ankle.
Strengthen your ankle. So we've got to look at your ankle range of motion and strength, one. More importantly, we have to look at the intrinsic muscles of your foot and how you stabilize. Most people don't even know how to kick those on and how to stabilize there.
At all.
So if I'm just like shooting in the dark here, I bet his is probably a little funky there. I would love nothing more than to look at it
Right.
and see like how his body moves and like what he's missing.
Yeah.
And then
Yeah.
get out of the braces.
Yeah. You don't need them greatest shooter ever. You just need the proper doc.
Yep.
You see what I'm saying?
Exactly.
Listen, if anybody set up a meeting with this guy,
Yep.
okay, take advantage of this. This guy is giving you peer locked in gems on how you take care of your body.
Yep.
Okay, like this is what we need. This is, bro. I am so in disbelief. Listen, I'm off script. I got no
I love
quick because all this coming straight from the heart. I am genuinely
Yep.
trying to figure out, like, ain't no way you ain't supposed to ice your ankle when it roll. My whole time, people been my own parents.
Yes.
Throw some ice on it.
That's what we thought. That's what everyone told us. Because that was like what we were told forever, right? Just, oh yeah, rest, ice, compress, elevate.
No,
It's garbage.
no, that is
Complete
not
garbage.
the thing to do.
Nope, it's not. Don't do that. Call me instead.
Okay, if you could redesign the healthcare system to better support PTs, what would you change first?
I'll be honest, I would totally get rid of insurance. I would totally get rid of it.
You know what? We got one of those.
Hey, there it is.
Hey, now, tell me why. For obvious reasons, we know why, but tell me why.
Yep. So I will say, like, insurance, it plays its role, right? Like, if I end up in the hospital or something, that is nice to have that coverage there. But the doctor that my wife and I see, so we see a cash-based primary care physician as well. I am all in on cash-based healthcare. I walk the walk in addition to talking the talk there.
Man of the people.
Yep. So the way that, and her name is Dr. Erin Schaefer, Moxie MD. She's amazing.
Shout out to her.
Yeah, she is amazing. I can't say enough good things about her. So the way that she explains it, which is perfect, is think of your car. You have car insurance in case you get in a wreck.
Right.
Right? Do you try to use your car insurance for an oil change?
Nope.
Do you try to use your car insurance if you're getting new tires or like rotating your tires or
no, sir.
God, like getting new windshield wipers or new wiper fluid or a new turn signal?
No. For
little tune-up things like that, that's not what insurance is for.
Right.
It's there for like the big things.
Yes.
And I'm glad it exists.
Me too.
I dog on insurance a lot, but I am glad it exists for that. But like for my back hurts, my shoulder hurts, I rolled my ankle.
The little tune-ups.
The little tune-ups, even like decently big injuries, like really straining something, you're honestly going to be cheaper coming to see a clinician that does not operate inside of insurance's parameters. So inside of insurance parameters, what you are trying to do is make sure that you document everything perfectly. Make sure you do this manual technique for at least 8 minutes so you get billed, so you can bill for it. Wow. 8 minutes is the cutoff. And then make sure you do these exercises in this way so you can build them as this code, which makes more money as opposed to this code.
Wow.
And make sure you do it for exactly 8 or 23 or 38 or 54 minutes. I'm kind of hazy on the insurance rules because I haven't played by that ball game in like a year. It's amazing. But and then if you do all of those things and fill out all of the paperwork and the patient happens to actually get better, well, like, cool. That's okay.
That's just a bonus. Like,
that's just like a bonus.
That was my job anyway, you know?
If you work outside of that, my job and my livelihood is on making you better. Because if I don't make you better, you're not going to refer people to me.
Exactly.
You're not going to tell your mom and your aunt and your cousin and your best friend to come see me when they have pain. Yeah. Right?
Yeah.
My job solely is when you walk in to make you better when you walk out. And that's like for most things that are just tune-ups like that, if you go outside of insurance, just to a clinician and just pay the cash rate, one, it's probably going to be cheaper.
Right.
We can go over the math of this all day long.
Yep.
It's probably going to be cheaper, and you're going to exponentially better care. Because that clinician is there with their name is on the line, and they have to be good. You got to show up and be good at what you do.
And see, that's what I love. I feel like insurance is a scam. I always say, I got car insurance for what? I feel car insurance should be a thing, but not to talk about car insurance, but it's like it shouldn't be as much. Okay? Just like with insurance, when it's like something that people can't control, it's not like I'm sitting here wanting my back to hurt. It's not like I went out here and say, oh, let me just roll my ankle so I can go see a physical therapist. Like, that's not something that we should be taxed for. Understand you got a job. You know, doctors got to make money.
Absolutely.
Nurses and on down line, everybody got a job to do. Hence why you have a job to do, because it's a cause and effect to everything, right? So pros and cons, but it's like, golly, I did not know the insurance game was such a big scam like that.
It's insane. And look at the pay rates for doctors, surgeons, nurses, physical therapists. Look at how those track with inflation, because they don't. Like, they get paid good money, but by comparison to what they were paid like 50 years ago, they don't get paid all of that much. Like, where is the money going?
Right.
Where? Somewhere in the ether. I don't know. But those insurance payouts are not going to clinicians. I can tell you that.
Questions that need answers.
They need answered. Answer us.
Hey, we want everything.
Yep.
We want, okay. What's the common misconception about PTs you wish you could erase from people's minds?
2 things. One is that they just wear khakis and polos.
Doc, you wear khakis. Yesterday we came. This is our second time doing it.
Yep.
You have so break it down.
So like when you think of a PT, you like think of someone that's like, usually you think of someone that's a little overweight that like used to be somewhat athletic.
Right.
They wear bad fitting khakis and like an old Nike golf polo.
I mean, true.
Like, look at the stereotype. Am I wrong?
Yeah, I mean, no, you're not.
It's not
you're
true.
Not, right?
That's like I don't know. I just hate that. I like dressing well in fashion and stuff.
Yeah.
There, so I don't know. That just like bothers me.
Yeah.
So that's one. We don't dress the good ones of us don't typically dress like that. Let me.
Yeah. No, just to clear this up, this dog got swag.
Hey,
okay.
here we go.
This dog right here
Yep.
don't come in with no damn no polo. No, he got khakis on, right?
I do.
But he sauces them.
That's
he
right.
sauces them all the way. The aura, the aesthetic. You got a flavor, Doc. And I am one of those people. When I first met you, I definitely thought you was gonna be the Doc that you just explained.
Yeah, exactly.
I like it.
Nope.
I'm talking about like sun, moon.
Yep.
That's you.
Yep.
That's you. Give me another one.
Someone on the subject. You know what I wore into the clinic this morning because it was kind of chilly this morning?
What?
Deep End Club hoodie.
Come on.
Yep.
Come on, man. Come on, man. This Doc got swag. I'm telling you, man. This is what it's for, man. Appreciate that, man. I love this guy.
Yeah. So that was number one, is the khaki and polo thing, which is kind of funny.
Mm-hmm.
And the number two is that all we do is give you a sheet of exercises and then maybe do like a little manual therapy on you
Mhm.
and then like hand you off to like an assistant or a tech or something there.
Right.
Like that's how insurance-based stuff works, because that's honestly what they have to do to make a profit, and it's sad.
Right.
But if you actually come see like a cash-based clinician, come see me, come see Sarah.
Mhm.
Sarah's exceptional at what she does.
Shout out to Sarah.
Yeah, shout out Sarah. She's so much smarter than I am.
Yeah.
She makes me look good.
Well, I don't know about that because y'all smarter than I am, so I can't say that. But Sarah, you
Yeah,
are
shout out
great.
Sarah. But if you actually come see one that's like cash-based, that truly understands the functional movement of how the body works
Mhm.
and understands regional interdependence, which
Mhm.
is how the pieces of the body work together, like it's so much different. The exercises that I gave, like I was seeing a low back patient before I came in for this. I saw a low back patient tonight. I saw one this morning.
Mhm.
The exercises I gave those two were drastically different
So different.
because they were drastically different people with drastically different types of pain coming from different muscles or different joints.
Mhm.
It like the idea, and I remember this from like places that I did like either clinical rotations on at or like worked at, is like patient comes in, oh, they're a low back patient, give them the sheet of paper with the
Yeah.
low back exercise. Well, like, what muscle in the low back hurts?
Right.
Is it a muscle at all? Is it a joint issue?
Mhm.
What motor control issues do they have? Is it a mobility issue in the low back? Is it a motor control issue with their core, hips, or pelvic floor? How does this sheet of like 5 super boring and like garbage exercises help that? It doesn't.
It does not whatsoever because, like you said, everybody has different pain.
Yep.
Everybody has different issues.
Yep.
Okay, so growing up, like me, I love basketball growing
Yep.
up. So obviously, I thought I was gonna be in the NBA.
Of course.
Did you have this like growing up? Like, was you always like, I'm gonna be a physical therapist? I'm gonna make people better. I'm gonna make people like function better. Like where did this come? Where did this spark come from?
I always knew I wanted to do something to make the world better.
Right.
Like, I'm only here, let's say on average I get 80 years to live. I'm going to do as much as I can in those 80 years to make the world at least a little bit better because I was here.
Right.
Like, I knew that, and I didn't know exactly what I wanted to do there.
Right.
So I grew up doing martial arts. I did Taekwondo.
Did not know that.
Yep.
Did not know you could put somebody in the box. Okay,
So
Doc.
it's, I did Taekwondo, gosh, from like age 6 to, I still dabble with it
Yeah.
here and there.
Yeah.
But like growing up there, a lot of people would come into our Taekwondo school like after like failed rehab and stuff, and just like try to be active.
Mhm.
And I got to where I was one of the higher ranking black belts at the school, so I got to like work with them and work on like, hey, let's like try this exercise and see how this works for you. That doesn't work. Okay, let's try this instead, or like,
Right.
whatever there.
Right.
So I don't know. I just started realizing like, hey, this is kind of cool. And my parents were like, you can do this.
Right.
Like, there is a career that does this.
That is dope.
Yep.
Now, have you noticed generational differences in patients' approach in recovery and wellness?
Yes. Oh my gosh, yes. There's a massive difference between, let's go like baby boomer to millennial to Gen Z. I don't have to like sell myself and my services to millennials and Gen Z.
Because you relate.
I relate. Like, I get the memes. I understand the TikToks
Right,
and stuff, right? So
right.
like we already speak on that basis there.
Right.
But like Gen Z and millennials are so disenfranchised with the healthcare system because it sucks that just the fact that I'm cash based and I'm not trying to push a pill
Right.
on them, they already like jive with what I do.
Yes.
Right?
Yes.
It's totally different for like your baby boomers
right.
that like they worked hard their whole lives and they got on Medicare and like, did what they what they could to get insurance,
Yeah.
and everything, and did like what they thought was right, which it was
Right.
at the time,
Right.
right? So now, like talking to them and saying like, "Hey, I don't go through your insurance." Like, man, they a lot of times they look at me like, "Are you like the devil incarnate? Are you some kind of shyster and everything?" And I explained to them like, "No," and I get where you're coming from. I totally. This is not the healthcare system like that
You used
grew up
to.
with. No,
Yeah.
it's not what it used to be. It's okay to be worried and scared about
Right.
it. Like, it totally is. Here is why we operate
The way we
outside
do.
of the traditional healthcare system and insurance.
Yeah.
And here's what we can do for you.
And it's honestly better. And
Oh
I'm
my
pretty
gosh,
sure
yes.
once you do your sales pitch, I guarantee you got them.
Yeah.
I know you do.
Yeah. And there's some patients that say like if they can't afford services,
Mm-hmm.
I have some clinicians that I know very well that still operate in the insurance realm that are doing the best that they can
Against the system.
and against the system, right? And I tell them like, hey, like you're not my patient, but I care about you.
Right.
Here's who I want you to go see. Like
Right.
they're gonna take pretty darn good care of you, and they're gonna try their best.
Now, do you think in the physical therapist world, like it's like people that's like, oh, this is my patient, I don't want to send you nowhere. Like I want your money. Oh, this is my patient, I don't want to see you nowhere. Like, is there a time where you refer patients to other doctors that like you can't fix?
Oh, absolutely.
And that's a common thing. That's like in the physical therapy world where that's like a common thing.
It depends on kind of ego.
Yeah.
Everything. There's a lot of ego in healthcare. You've seen like Grey's Anatomy and everything.
Yes.
It's dramatized, but there's like some truth to it
Yeah.
there. But like good clinicians, like we can admit when like, hey, I've given it my all. This is obviously beyond what the scope of what I can do conservatively.
Mm-hmm.
Let's get an X-ray or an MRI and let's go to the next step there. And I have a couple doctors that I know that are shoulder, low back, knee specialists, and I tell my patients like, I want you to see this clinician specifically, and then I text that clinician like, hey, and I'll do it in a HIPAA compliant way, just FYI to feds. Like I won't say names or anything, but like, hey,
Right.
you're gonna get a patient. Can I shoot you a call at some point? I will
Right.
tell you about them, which I'm able to do.
Right.
Here's what's going on, and here's what I've tried and it's not working. I'm gonna hand them off to you.
Now that's caring. Like, what's been the biggest challenge of running a concierge clinic at the stage in your career, and the most rewarding part of it all?
Let's start with the good. The most rewarding is that I get to come in every single day to patients that want to be there,
Right.
that will work their asses off to get better because
Right.
they're putting money up for it, and they like believe in what we're doing. It's the most fulfilling thing because it's like they're not just coming to the clinic because I can help them, like they are, but they're also coming to the clinic because they believe in what we're doing. They believe that this healthcare system sucks, and this guy is trying his damnedest to fix it, and I support him. And I'm coming in for that. So it's like it's more than just like coming into a doctor's office. Like you just feel it. Like you feel the movement of like they get it and they believe it,
Yep.
and they're doing what they can to make it better as well.
Yep.
That is by far the best part,
That's great, man.
bar none. So that's the best part. What the other one was like the most challenging.
Yep.
Right. I would say the most challenging is turning it off. Right. Like
Yeah.
actually
man,
coming
yeah.
home and resetting and like hanging out with my wife and dog and cats and
Yeah.
goats and everything and turning it off. When I get home finally, it's like, man, I could do this content, or man, I should have tried this with this patient, and oh, I need to reach out to this patient tomorrow and see how their basketball game
Yeah.
went and everything.
Yeah.
It's like it's hard to turn off because I've just like I get so locked in on it, and I like lose track of time.
Yeah, you want what's best. Like
Yes.
Doc, I'm the same way.
Yeah.
I cannot turn this off, and it's like all I do is eat, breathe, and sleep it.
Yes.
Like
Oh, yeah.
it's like I always want to get better. I know there's room to like improve, and my
Yeah.
biggest thing is I can't be outworked. So I would not let
Yes.
nobody on the other side of the world outwork me in the same position. I'm in my own lane,
Exactly.
but it definitely gets hard to turn off
Yeah.
when you're really passionate about
Yeah.
it. I can relate to that, man. What's some advice you would tell your younger self?
Don't try to be cool. Actually, be yourself. Like being passionate is cool.
Right.
It's not cool when you're in high school, right? It's not really that cool when you're in undergrad either. But it like passionate people change the world and they make it a better place. You look at every single person that's made a tangible change, right? Like look at like Steve Jobs creating Apple. Like we're literally recording this on a MacBook.
Literally.
You got an iPhone.
Literally.
I've got an iPhone. I got an Apple Watch on.
So do I.
I've got AirPods.
So do I.
Right? Like if you like read his biography, he is not normal. And he is not like a chill dude. He's passionate. He's anal about everything. So him, look at like Elon Musk. Like, dude, they're landing rockets on like chopstick.
That's
he's
crazy.
No, he's like not cool. He's nerdy as hell.
Right.
And he just lives and breathes what he does. Like, people like that actually make this world better. And it's like, it's cool and it's awesome to be so passionate and care so much about something.
What does say? You say passionate people change the world?
Yeah, they do.
Damn, I like that.
Yeah.
I like that because that's true.
So we, like I said, are concierge, cash-based. That does mean we still take card. We do not actually only take cash.
Right.
Some people have asked me that. We take card, we send invoices, blah, 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 all of that. We see all of our patients one-on-one for an hour. I will never compromise that.
Okay.
That will never change. If we do this interview 10 years from now and I have 5 other clinicians working with me, we will always be one-on-one for an hour. That will never change. As long as my name is on the business, that's not changing. One-on-one for an hour, it's always a flat rate, right? Like, you actually know what you're going to pay.
Right.
Which is like, when you go to the doctor, how much does it cost?
We don't know.
No, we don't know.
Yeah.
You'll figure it out 3 months later when you get a bill.
When you get that bill with a comma in it.
Yeah, with a comma. Our bills don't have commas.
This is a one-of-one type of physical therapist. I'm telling y'all, this is the best PT there is.
So it's flat rate to see us. It doesn't matter what we do. It's $95 when you see me. It's $80 when you see Sarah.
Okay.
Yeah, probably next year it will go up just a little bit, just to track with inflation. And we've got some really cool stuff in store for the clinic that we want to be able to
listen.
pay for.
$95 is still a deal for real already.
Yeah.
You know what I'm saying? Could you what include? I guess it's gonna be different because every patient is different. But what's the basis? Like, what does it include?
So every time you see me, you get the 3 R's: reset, reinforce, retrain.
Right.
We're gonna test at the beginning to see what's not working.
Right.
We're gonna test at the end. I don't care if it's the first time I've seen you. I don't know. I don't care if I've seen you 10 other times. We're going to test and retest every time. That's the only way I know if what I'm doing is helping.
Right.
You are paying me to help you.
Like a progress report.
Yeah. Probably be able to show you if I'm helping you or not.
Right.
If you are paying me about $100.
You should probably feel if he's helping you or not. Because I definitely felt it from 45 minutes.
That's right. No, every time you come see me, you should feel better. If not, I have done something wrong, and I need to figure it out. So, always an hour, always a one-on-one. That will never change. 95 to see me, 80 to see Sarah. Again, that might change in the future. There,
right.
That's pretty much how we operate. It's really that simple.
1, 2, 3.
1, 2, 3. That's it.
4. Get better.
That's right.
So
always get better.
So run it to him again. Number 1.
Number 1, reset.
Number 2,
reinforce.
Number 3,
retrain.
An hour of your time.
That's right.
Every single time. We're not compromising that. Let them know where they can find you at.
So we have 2 locations. In Springfield, we are inside of M Fitness, which is over behind Target.
Yep.
Next to like Peace, Love, and Sweat, Gypsy Soul.
Right here. Look, they got a picture right here.
I say we'll throw the address up there. That's 1, and then 2, our location in Verdon, which was where we originally started.
Right there.
We're gonna throw it up here inside of the Zone. That is the OG where it all started. So you can see us at both. You can check us out on Insta or Facebook. Magelitz. Let's see here. Magelitz Clinic Conservative Medicine. You can DM us there if you want to get in. We had a clinic text. You can even text. I don't like talking on the phone. Do you like talking on the phone?
No, I do not. I will preferably text you so I can research what I'm about to ask you. Because you are great at what you do. I cannot listen. Forget the podcast. This is great, Doc. This is gonna help so many people, and I hope this reach so many people because I have a lot of athletes that I follow. I have people that DM me literally like, "Hey, put me in with the doc." I'm like, "Hold on," you know what I'm saying? Like, I need a little more information or whatever. Put me in with the doc. I have younger athletes that say, "Hey, man, that was pretty cool. I want to do the such a cup thing." You know, they looking at LaMelo Ball, Anthony Edwards, Jason Tatum, all those people. They're starting to look at them and they seeing the treatment like that, and they're starting young. Like you said, these kids are athletic. This is gonna change the world.
Yes.
I'm hoping this reach a lot of athletes. Listen, see this, get in with the doc, man. This has been like by far episode 4. Okay, the best episode I have yet to record. The most informative episode I have yet to record. This is the best way for me to retain this information, doc. Like, I'm not even kidding. Like the exercise and everything like that. I'm putting videos right here. Yeah, I'm putting videos right up here because I want y'all to see and visualize the exercise that you can be doing at home that these corporations are not telling you. These other doctors and the other physical therapists, they're not informing you because they don't want
you to get better.
They don't. They want you to come right back and see them
3 times a week.
3 times a week, and we're not doing that. Okay, we're trying to have you not come see us? Refer
Oh.
people that are actually hurting, bring them to us. Bring them to where?
Bring them to Magelitz Clinic, Conservative Medicine.
Come on, man. Hey, this has been another great episode of Hi There. If you would like to come get anything off your chest, promote any business of your kind, you can be right here where the doc is at.
Hanging out
All
with
right.
us.
This is the platform for you. Thank you
Thank you.
for coming on here, doc.
Absolutely, anytime.
This ain't mic'd up with the doc, but you could be.
You could be.
All right.